Esta, BSN 1D, and for today's video, we will be doing a neurological assessment. So the materials that we will be using are, we have a newspaper here, calamansi juice, sterile cotton balls, opaque card, Snellen chart. We also have an alcohol here for disinfection. We also have a clean gloves, a pen light, paper clips, a key, and also a cotton tip applicator. And also we have a tongue depressor. So before I start my assessment, I will do a hand hygiene. And I will not using a clean gloves for me to be able to touch and properly assess the muscles and other parts of my patient. Hello sir, good morning. I am Neurological Assessment and I will be your student nurse for today. So for your verification, may I know what your name is?
So my name is Lloyd Andrea Esta.
Okay, Lloyd Andrea Esta. Your age and birthday po?
My age is 17 years old and my birthday is on November 19, 2004.
Okay, very good. So before we start our assessment, I will ask some questions to you sir. So our assessment today is a neurological assessment. Okay, so for your first question, sir, so do you experience headache po?
These days wala naman.
Okay. So, do you experience seizures po?
Wala.
Wala din. So, do you experience dizziness po?
Wala naman.
Okay, so for your next question, so have you noticed a decrease in your ability to smell or taste po?
These days naman, so wala naman akong
Okay. Okay, so very good. So, have you experienced any ringing in your ears? Any ringing in your ears? Like,
no.
Parang may narinig kayong iba or...
Wala naman.
Okay. So, have you noticed any change in your vision po?
Medyo may konti. Pero,
okay. Okay, sige, sige. We will take note of that. Okay, so, do you have a difficulty understanding when people are talking to you?
Wala naman, hindi.
Okay, very good. So, do you experience difficulty or swallowing?
No, wala.
Wala din. So, have you lost bowel or bladder control or do you retain your urine?
Retain naman.
Okay.
Wala namang problema yung ano ko, urine.
Okay, sige, very good. So, do you have a muscle weakness po?
Wala naman.
Okay, so do you have any loss of movements?
Wala naman.
Okay, very good. So, do you experience any repetitive involuntary trembling po? Nung nanginginig kayo?
Wala naman.
Okay, very good. So, do you experience any memory loss?
Wala.
Okay, very good. Okay, so your past health history. So, have you ever had any type of head injury po?
Head injury, wala.
Wala, very good. So, have you ever had meningitis?
Wala naman.
Okay, very good. So, for your family history, so, do you have a family history of high blood pressure, stroke, Alzheimer's disease, dementia, epilepsy, or brain cancer po?
Sa mga sinabi mo, wala naman po.
Okay, very good. So, for your lifestyle and health practices, so, do you take any prescription or non-prescription medication po?
Siguro vitamins, siguro.
Vitamins, very good. So, do you smoke po?
No.
No.
Never.
So, do you wear your seatbelt when riding in vehicles po?
Yes.
Okay, yes, very good. So, describe your usual daily 24-hour diet recall.
I think, ano nga yun?
Okay, so, do you exercise or
I think I exercise naman siguro once a week.
once a week? Okay,
Never
so,
naman. So, at nag-eat naman ako 3 times a day.
okay, very good. So, have you ever had prolonged exposure to lead or insecticides?
Exercise wala naman.
Okay, so, okay, very good. So, okay, that's all for our questions, sir. Thank you po. Sir, so for our first assessment, we will do a visual test acuity. So, we will be using a Snellen chart. At nilagay ko na po doon. Then, I will position you 20 feet away from the chart. Okay, sir. So, magsisimula na po tayo. Tumaya pa po doon, sir. Okay, so, You will cover your left, okay, so magsisimula tayo sa inyong left eye. Okay, so ayan po sir, ang basahin niyo po mula sa umpisa.
Excuse me. E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, T, P, O, T, E, C, L, E, F, O, D, P, C, T.
Okay, so ang sa kabila naman po sir. Okay, from the start po.
Okay, E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, O, O, T, E, C, L, E, F, O, D, P, C, T.
Okay, very good. Okay, sir. Okay, sir, for our next assessment, we will do an eye confrontation test. So, we will be using an OP card. O, saan niyo po gusto mong sisimula, sir? Okay, so i-cover niyo po yung left eye niyo, so i-cover ko yung right eye ko. Tapos, focus lang po kayo dito sa mata ko. Then, gagamitin ko po yung fingers ko. Then, if makikita niyo na po, magsasabi lang po kayo ng stop. Okay, sir? Okay, start.
Stop. 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 Stop.
Okay, sa other side naman po, sir.
Stop. 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 Stop.
Okay, very good, sir. Next assessment, we will do a near vision test po. So, I will give this newspaper to you. So, can you read at least 2 sentences, sir? Wait lang po. Okay, so, start na po, sir.
The goal, intent, or purpose to be communicated by a teacher is expressed through a message. In reality, the message is a physical form of words. It is the translation of ideas, the purposes, or intentions of the teacher.
Okay, so we will read again, sir. So, we will be using an OP card. So, saan niyo po gusto mag... Okay, so left eye po. Okay, so can you read again, sir? At least 2 sentences po.
The purpose of communication may be to inform, persuade, or entertain. A teacher communicates to her students not only the intended message, but certain aspects of personality and feelings of which she is unaware of.
Okay, so sa other eye naman po, sir. Okay, so switch lang po. Okay, very good, sir. So at least 2 sentences naman po.
To encode the purpose of the source into a message, a channel is needed. In the case of face-to-face communication, the encoding function is channeled directly by the intellect, the sensory and the motor skills of the source, such as the vocal mechanism for oral communication.
Okay, so very good, sir. Okay na po. Okay, so next, sir, we will do a 6 cardinal position gaze. So, I want you to follow this pen. Pero nakafocus lang po yung eye niyo sa akin. Okay, mag-start na tayo, sir, ha? Okay na po?
Okay.
Okay. Okay, so follow niyo po, sir, ha? Okay. Okay, so, i-check po natin yung pupil niya sa eye, sir. Okay, okay naman po, sir. Okay, so, I can see that both of your pupils react to light. So, your pupils are round, are reactive to light, and accommodation po. Very good. Okay, so that's for our cranial nerves number 2, which is an optic. Sir, can you close your eyes po? Okay, so I will give something to you, then you will just smell it and guess what is this po, ha? Okay po. Okay. Hold it po, sir. Then cover your other nose po. Hindi, isa lang po. Yung isa lang po.
Calamansi juice?
Okay, very good. It's calamansi juice po, sir. Okay na po. Okay, so for our next assessment, sir, can you smile? Frown? Okay, your teeth plate po. Like this, ha? Okay, so I'm gonna hold you this, sir, ha? Okay, so again, sir, smile. Okay, frown. Okay, can you show your teeth plate, sir? Okay, so very good. So I can see your muscle is intact din right now. Okay, sir. For next, sir, I will be using a sterile cotton. So, close your eyes, sir. So, every time you feel the cotton whisk, can you say stop, sir? Okay? Okay.
Stop. 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 Stop.
Okay, very good. Okay, so next, sir, we will do a testing on your corneal reflex. Okay. So, can you look at the other side po, sir? Ang up po, up. Okay. Okay, so I can see nga yung ang time na nararamdaman nyo na po ito, nag-reflex yung sa eyes mo, nag-blink ka, and that's a very good po, sir. Okay, so next we'll do a cranial nerve number 7, sir. So, can you lift your eyebrows po? Okay, down, smile, frown, squint your eyes po. Very tight po. Okay, very good. For cranial nerve number 8, so I will whisper something in your ears, sir. So I want you to repeat it. Okay na po ba? Okay.
I love you.
Okay, other one po.
How are you?
Okay, so very good, sir. So your acoustic nervous is intact din naman po. Okay, next, sir. So we will do a cranial nerve number 9 and 10. We will check your cranial nerve number 9 and 10. So now we will be using a tongue depressor and a pen light. So can you open your mouth, sir? At your tongue pa. Okay, tongue out. Say ah. Okay, very good. So, sir, I can see your uvula goes up and the soft palate goes down. So that indicates that the cranial nerve number 9 and 10 is intact po. Next, sir, so we will check your cranial nerve number 11. So, can you turn against my hand po? Against my hand po. Okay, sa other side naman po. Okay, so, ang shrugs up po. Okay, down. Oh, very good. So, I can see that your cranial nerve number 11 is intact naman po. Okay, so for our cranial nerve number 12, sir, so can you stick your tongue out? Okay, very good. So, okay na po, sir. Okay na po. So, okay. So, your tongue is, it should be in the midline and very good naman po. So, next, sir, we will check your muscle strength. Can you lift up both of your hands po? Okay. So, at the 10 seconds. Okay. So, next, sir, can you squeeze my hand po? Squeeze my hand po. Really, really tight po, sir. Okay na po, sir. Okay, very good. So, we do the test because that is part of our NIH stroke skill po, sir. So, that is also part of our neurological assessment po. So, we already done sa checking the upper extremities muscle strength of our patient. So, next, we will go now sa lower extremities of my patient. So, can you lift up one of your, okay. Okay, very good. So, other one naman po, sir. Okay, lift both of your, okay, so press against my hand po, sir. Okay, very good, sir. Your coordination, sir. So, can you do this with your fingers po?
Just one finger.
Okay. Starts from your right finger, really, really quick. Okay, so, other one naman po. Okay, very good, sir. So now, okay, touch your nose. Then, after that, touch my finger po. Okay, so start. Okay, sir. Sir, so next, sir, we will perform a heel to shin test, sir. Can you start, sir, using your, okay. Okay, other one, sir. Okay, that's all po, sir. Thank you. So now, we will test your coordination. Can you stand up, sir? Okay. Close your feet together. Close your eyes. Okay, for 20 seconds. Okay, so very good, sir. Can you go there, sir? Okay na po, sir? Okay, pumunta po kayo dun, sir. Okay. So, walk from there to here, sir. Okay, walk, sir. Okay, so, bumalik ka po doon, sir. So, walk again from heel to toe, sir. Okay, sir? Okay, umikot ka po, sir. Okay, then, walk heel to toe, sir. Okay, that's Assessment, sir, we will check your dull and sharp sensation po. So, whenever you feel a sharp, you say sharp. Then, whenever you feel a dull, then you say dull. Okay po, sir? Okay, close your eyes po. Okay, we will start.
Sharp, dull, 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 sharp, dull.
Okay, that's all po, sir. So, next, sir, we will use again a sterile cotton. Then, we will check again your light sensation. So, whenever you feel the cotton whisk, you can say yes. Okay, close your eyes, sir.
Yes, 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 yes.
Okay, sir. So, very good. Okay na po. Can you open your eyes na po? Sir, so next, can you lift up one of your hands, sir? Then, I will put something here. Then, you can close your eyes and tell me what's on your hand. Okay, close your eyes po, sir. Okay. What is
It's a key po.
Okay, it's a key. Okay, you can open your eyes na po, sir. Okay, very good, sir. It's a key po. So, next, we will check his deep tendon reflexes. But since we don't have a hammer here because it is too expensive, but the deep tendon reflexes is part of our neurological assessment. And also, the tuning fork and the ophthalmoscope is one of our requirements in our neurological assessment, but we don't have one here because it is too expensive, but it is also part of our neurological assessment. Check the baboon side reflex. So we will draw a letter J to the socket of our client. So I'm using my cotton tip applicator. Okay, we will start na, sir, ha? Okay, so that's a aroma reaction po, sir. Very good. Okay, so that's all for our neurological assessment, sir. Thank you for your time, for your cooperation. So stay safe and stay healthy. And thank you so much, sir. Thank you.
Thank you.
Okay, so now that I'm done with my assessment, so I will clean my area. Okay, so that's all for our neurological assessment. Thank you.